and working with Tamsin, who's going to be our first presenter on the Farm SP study. So Claire, you've already said that we are recording this session, and we've also got an illustrator, Tenley, who is going to do some live scribing, and that's Nifty Fox. So just background, farmers and people living in rural areas and agricultural communities are at risk of depression, anxiety, often related to the environments in which they're living and working, but also to external pressures and social isolation and social media and mainstream media impacts. And we also know that people who work in long hours, like farmers, find accessing services very difficult. So the webinar today is going to present a range of current research and innovation, which aim to improve awareness of and support for people in agricultural communities. So I'm going to start off by introducing Tamsin, who's going to talk about the Farm SP study. Tamsin.
Thank you. Yes, so short title Farm SP, but we'll be talking through some of this, sort of how we've been exploring supporting help seeking in farmers to prevent self-harm and suicide. And this was a multi-method study. So just a little bit of background. I know Carolyn has just very kindly shared some information already, but so the Farm Safety Foundation are an organisation that support farmers across the UK for a variety of different things. But they also conduct a survey most years as well, of around 800 farmers from across the UK. The most recent survey that's currently published, around 44% of farmers aged 41 to 60 are working more than 81 hours a week. And approximately 91% of British farmers rank poor mental health as the biggest hidden problem currently facing the sector. There are a number of different challenges that can cause increased levels of stress, including the climate change. We'll hear a little bit about that today. Financial difficulties, most recently some of the inheritance tax bill has caused significant concern amongst the community. Reduced funding, recently the falling milk prices, making dairy production almost unprofitable for some farmers, and also a lack of help seeking for both mental and physical health. Farmers are often short on time, are often very isolated, and this can lead to loneliness. All of this combined can lead to an increase in stress, risk of anxiety and depression, but also a risk of suicide. And I think something that's really important to note is that farmers have access to means for suicide in the forms of firearms and poisons. And this access, they are very aware of this, and that's one of the key factors for them being more reluctant to seek help from health services. If they have depression on their medical record, there is a risk that they could lose the firearms. The police are able to take the firearms away. Now, for some people, these firearms may just be on display. We spoke to one young lady who, in their family, and they are the firearms in their property. One of the firearms was its third generation, and she didn't want to be responsible for the loss of that firearm in her family. So the aims of this project was to explore some of the lived experiences of the mental health difficulties, so stress, distress, anxiety, depression, self-harm and suicide among farmers. We also spoke to some of the family members of farmers as well, to better understand the culture of mental health and within the community. We were exploring the attitudes and beliefs around help seeking. So what help is out there? How do they seek help? If they do, and if they don't, why not? What does that look like? Identifying some of the barriers and facilitators to help seeking, but also to co-design a care framework for an intervention to care needs, to connect needs, preferences and opportunities to support help seeking for mental health problems in farming communities. So we've worked across 2 work packages. So we've conducted a number of observations in farming spaces, whether that's livestock markets, agricultural shows, but we've also, as I say, interviewed people with lived experience, and also interviewed people that are supporting farmers, whether that's health and social care professionals, veterinary practice staff, and also voluntary sector representatives. And then we pulled everybody together into a big dissemination event 2 weeks ago, I think it was, where we started to map out where we go next. All of this work has been underpinned by 2 amazing advisory groups, and we've also had 4 co-applicants on the project who are sort of embedded within the farming community as well. So embedding ourselves in the community has been really important to actually engage with the farming community. So I'm not a farmer myself. I grew up in rural Suffolk, but I don't come from a farming background. So it was really important that we embedded ourselves within the community and that we were trusted in order to be able to actually speak to people about some quite sensitive topics. And we did this in a number of different ways. So first of all, the observations were as data collection, but there were also an opportunity for us to get out into the community, to meet people, to understand some of those challenges and see firsthand what's happening. But we also hosted a number of what we called our pie and pint or paint and pastry events. These have been split across the course of the project, and we allocated quite a significant budget for these. And this is where we might make so one event. For example, we sponsored some food, and we attended a farm walk. And we've hosted a pie and pint evening in a local pub where we invited some farmers to speak with us and just share their experiences. But these have been more informal events. These have not been part of the data collection process, but more as part of embedding ourselves within the community and trying to build up that trust and rapport with the local agricultural community. So in terms of our data then, as I said, we've done a number of observations across livestock markets across 3 counties in the Midlands. Something that we picked up on each of the markets have quite different support available to the farming communities and resources available. Some of the markets had Samaritans were attending regularly. Some of the markets have an on-site nurse practitioner. Some of the markets have nothing at all, although on some market days, the farming community network will be present, and also the health check buses have also been attending a couple of the markets as well. When we've been speaking to people within these markets and at the agricultural shows, it's been quite interesting to navigate the conversations around mental health. So when we introduce ourselves as we're researchers, we're working in a mental health team at Keele, the number of people that then think, oh, did you hear about the suicide the other day? Or, oh, actually my cousin took their own life recently, or my uncle. There's a conflation between mental health and ill health and suicide is really, I'm going to say shocked. I didn't quite expect people to relate the two so closely. There was nothing in between. Anxiety, depression, as far as for the most part, most people don't believe that exists, although they relate with stress. They understand it as stress. So when we talked to some people about so one gentleman said to us, oh, well, what is anxiety anyway? And we had a little bit of a conversation about it. He said, well, that's just normal. You just pull your wellies on and you just got to get on with it. And farmers generally don't see themselves as candidates for care. So they can see that those around them need support, but they will not go and seek support from themselves. Again, a conversation we had with a couple of farmers, we'd ask the question, if you needed help, would you ask? Oh no, definitely not. If you saw your friend struggling, would you suggest what would you do then? Oh well, I'd encourage them to reach out. So they're happy to help support each other, but not themselves. The veterinary practice staff recognise that they are very much working and are embedded often within the families, and they see and hear everything for the most part. This is predominantly for the livestock farmers, arable farmers, solely arable farmers. We've not been able to speak to any farmers that are just arable. So this is obviously just relating to livestock farmers. But there's one vet that we spoke to, she talked about that actually they are often become sort of embedded within the families and they hear about the family rifts. But most vets that we've spoken to don't receive any formal training on sort of mental health support for farmers, although they do regularly pass on the details to the farming community network. Something we naively came into this project with, we weren't quite aware of sort of the amount of support that and the level of support that is available to farming communities across the UK, but particularly across the Midlands where we've been working. But many people that we've spoken to are reluctant to seek help, or they're only seeking help when they are at crisis. So what we wanted to look at was understand that a little bit more. And something that's really come through was around the family dynamics and generational attitudes to help seeking. And this can actually both help and hinder the way and when farmers seek help. So this is just one example of one farmer that we've spoken to who he had been diagnosed with depression and he had got a history of suicidal ideation. So he was living with his mum and girlfriend at the time, and neither of them would support him. Neither of them wanted to admit that he'd got a problem, and they kept saying that there's nothing wrong with him. You're being lazy and you're being awkward. He kept saying there's something wrong, but they couldn't accept it. Health services were generally seen as quite inflexible, and the continuity of care was really important. They need to see somebody on the regular. So the market that we attended that had the nurse practitioner on site, it took quite a while to become trusted in that space. But the way she interacts with the farmers and the way that she gets them on side, it was really great to see how she worked with them. Or one health professional we spoke to, so she was a psychotherapist and a social worker, and she actually conducted her therapy in the milking parlour. So she would sit on the dining chair at one end of the parlour, and they would shout across the parlour, and that's how they conducted their therapy. And it worked for them, and it worked for the farmer. He didn't want to come to her. He didn't feel he had the time to be able to do so. In terms of health professional understanding of some of the challenges as well when farmers are struggling, one farmer we spoke to, he was experiencing suicidal ideation and thoughts of suicide. And when he went to go and seek help from his GP, the GP told him that he should quit his job because that's what was making him depressed. Now, one of the challenges of that was he lived and worked on the farm. It was a family business. He was a partner with his mother and his brother. And this meant that it wasn't possible to leave the farm. Even if he did quit his job, he was still very much living 360 degrees around him was the farm. So there was no way of getting away from it. So in terms of conclusions and next steps, farmers are generally aware of the support available, but they are reluctant to seek help, or they only seek help when they are in crisis. Farmers do not see themselves as candidates for care, but do often encourage their peers to seek help, or it's often the farmers, the wives and partners that are often seeking help as well on behalf of the farmers. Farmers value the social opportunity, so it's important we need to work out a way of creating more spaces for them to talk. And I urge any health professionals to ask the question, how are you and how are you really doing when speaking with farmers in whatever situation it might be, even if they're coming in for physical health. Just a huge thank you to the NIHR, so 3 schools, for funding the project. This is our research team and everyone that's been involved over the last 15 months, sorry. And I'm more than happy to take any questions.
That's great. Thank you, Tamsin. Has anybody got any questions? There's nothing in the chat. So, I mean, obviously I'm part of the research team, but I think you highlight the fact that such a lot of work is done at livestock markets, but you raised the question about arable farmers, and it would be great if we could have a think about how we might meet the needs of those farmers who are very isolated. Matt, did you put your question up to ask a question? Yeah.
Yeah, I was just interested in, so what's the next step? You've established a lot of the barriers and the need. What's going to happen next?
That's a really good question. So I think that's something that we're working through the sort of more in-depth analysis at the moment. I think that we're looking to produce some sort of infographic or a short animation that we can be sharing with health and social care and also or other organisations that are supporting farmers, whether that's even local authority as well. That's sort of like in the immediate. In terms of future research, I think that's going to come through as we do the analysis. We've got some ideas, but I need to just sort of firm that up a little bit before we take it any further.
But I think opportunities like this webinar to build connections are really important, because I think all too often researchers work in isolation, and it's only with publicity about this project that we've managed to make connections with people across the country, which has been great.
Absolutely. Yeah.
I'm going to take Chair's prerogative and allow one more question.
Nigel Taylor,
Nigel.
I think he's got a hand up.
Yeah, thanks very much. Quick question. Have you come across any work, Tamsin, regarding overcoming stigma amongst the farming and particularly farmers community?
So I know a lot of the charities are doing quite a lot about overcoming stigma. So the Farm Safety Foundation, or the Yellow Wellies, and also Farming Community Network, they do a lot of advertising. They do a lot of social media publicity to try and support farmers and encourage farmers to seek help. In terms of research, there is some out there. Off the top of my head, I can't remember who is doing it, but I can have a look, and I'm happy to. I think we've got if you're happy for me to send it over to you, we've got
That's
your
great,
email address,
Tamsin, yeah.
so I'll dig it out and I can send over anything we've got. But,
Thank you.
Great, thank you. Okay, so I'm going to move on. Thank you very much, Tamsin. That was really good presentation. Thank you. So I'm going to invite Dan Blake. Now, I think we just continue the slides. So Dan Blake's from the UK Health Security Agency, and you're going to talk about the impact of drought and flooding on farmers and farm workers.
Thanks. Yeah, and thanks for having us. Hopefully you can see the slides. Okay, does that look okay at your end?
Yeah.
Yeah. Cool.
Yeah.
Yeah. Thanks. Yeah, so as Caroline mentioned, we're going to talk about the mental health and well-being of farmers and farm workers impacted by flooding and drought. So this was a project, a sort of research project that started just over a year ago now. It was part of the Health Protection Research Unit. The initial idea was to develop a sort of protocol and methods around this project, but we took it a step further. And I'm kindly joined by Maya today from the University of Oslo, doing a research project there, sort of looking at the next stage of this, and she'll be talking in the second part of this presentation. So I'm in the Centre for Climate and Health Security at the UK Health Security Agency, and Maya's in the Department of Community Medicine and Global Health in Oslo. So just to give a bit of context, so in the UK we're experiencing warmer, wetter winters and hotter, drier summers as a result of climate change. And the National Risk Register sort of outlines some of the significant to potentially catastrophic sort of risks and impacts we can see from flooding and drought in the future. And we've seen some of the severe impacts in recent years, as shown by the photos in this slide. It's quite well documented that exposure to flooding and drought is a known and increasing issue for mental health, and farmers are a group who are particularly exposed just because, as we've heard, their livelihoods are sort of so dependent on the land. So various studies show higher rates of depression and anxiety among farmers, as we've heard, but there's often sort of other mental health impacts recorded following flooding and drought more generally as well, such as PTSD, suicide, and social isolation. There is a bit of a sort of knowledge gap, though, in that a lot of the evidence around sort of flooding and drought and mental health impacts sort of comes from overseas. So such as for drought, there's a lot of sort of research from Australia, for example, but droughts in the UK can be quite different. It depends on the geology, and the sort of health impacts vary quite a lot between communities as well, and they're often intertwined with sort of many other sort of local and regional factors. So this is why we sort of focused on England in particular. Oops. So this slide just shows some of the sort of methods and data collection for the first stage of the project. So we conducted an online baseline survey, which was distributed through sort of trusted intermediary organisations, I've called them here, such as the National Farmers Union. They helped out a lot to distribute the survey. It's a bit different from the first project that we heard about, that it's all sort of online. That was because of sort of funding restrictions, I suppose. But yeah, we did this online baseline survey first, which was targeted at farmers impacted by flooding and droughts, particularly over the last sort of 5 years or so. And the 4 sort of key topics that we covered are shown on this slide. So we collected sort of demographic information, some details around experiences with flooding and drought, mental health impacts that people had been experiencing at a fairly sort of high level, and then sort of started to get into coping strategies and support a bit more in some of the in some of the survey questions. And we allowed sort of options for open feedback as well, and an option to contribute to the interview component of the study, which Maya will talk about shortly. But a key set of the sort of questions that we asked was a sort of standardised set of questions called the Warwick-Edinburgh Mental Wellbeing Scale questions, and this was partly to allow us to sort of have a sort of longitudinal comparison sort of through the project, and to compare with sort of other studies that have been done in the past. Sorry, I keep pressing the wrong button on my end. So I just put this slide up just to show that, we've now had the sort of protocol and the sort of methods published, so people can find this online if they want to read that more about the study. And I'm happy to share some of the sort of key survey findings with anyone who'd like to see those as well. But I've put some of the key findings on the next slides as well. So we had 93 full responses in total from the online survey, which is quite a small but quite representative sample. It seemed to be quite representative of the sort of UK farming population in terms of different farm types and sort of demographics. So that was quite good. We found that sort of flooding events were more commonly experienced by participants than drought, but we did conduct the survey before the previous summer, so that might have changed somewhat since then. Nearly 3/4 of people reported that they thought flooding was becoming an increasing issue for their farm. But something that was quite apparent from different answers to the questions was just the sort of length of impacts that people were experiencing, often for several weeks to months after the floods or the droughts had occurred. And 89% of survey participants stated that they felt stressed due to flooding or drought at least some of the time. And this aligns quite well with other surveys that have been done in the past as well, such as by the National Farmers Union and the Rabi charity as well. And this slide just shows some of the sort of coping strategies that people highlighted. So talking to family and friends was quite widely reported, as well as physical exercise. But some of the sort of open text boxes where people sort of were allowed to put what they wanted were quite interesting. So several people mentioned sort of walking the dogs as a strategy, also resilience building activities on the farm as well. So this is something we sort of hoped to tease out a bit more in the interviews. And then we also asked about mental health support and whether people thought that this was adequate. 45% of people stated that they were unsure if they had adequate support. And so we hope to explore some of the sort of barriers a bit more around this. Financial support and government policy changes were sort of common recommendations provided by participants of the survey as well. And there appeared to be quite a lot of onus on the national government to be responsible for a lot of this support as well. And I'll pass over to Maya now for the following slides. Thank you.
Thanks so much, Dan. So as Dan explained earlier, the UK HSA was mainly responsible for the survey component, and then I came in sort of to do extra analysis on that, and then also to conduct the interview component going forward. So of the 94 participants that replied to the survey, about 20 or so agreed to sort of be contacted further and go into the interview. So in the end, I conducted 10 interviews on Zoom and Teams. And the sample characteristics of that were generally, there was 8 to 10 that identified as male. We had quite a good mixture. So we had cereal farmers, lowland grazing, a few dairy farmers, and we even had like basket tree willow farmers as well. So, and some that were involved in environmental schemes. Farmers had been in the profession for a bit longer, so 40 years plus. There was 8 of them, but we had 2 that were sort of in that in between, where they'd sort of been in the profession between 10 and 19 years. Just showing the next slide. Hopefully that worked. So a few of the key themes. I don't know if I've frozen a little bit because that. Hope it's okay. So the main thing we found is people did feel that. Where the patterns had changed, particularly around the intensity of flooding. So it wasn't so much the volume of rain, but it was more how much they were getting in short periods of time, which was harder for them to recover from. The same with drought. A few of the dairy farmers in particular actually communicated that it could be a positive thing, but they felt over a long time that they needed more drought resilience. And a lot of them were having to adapt in so many different ways in order to sort of continue the profession. So the next slide is a bit on the emotional impacts that were found. These are all quotes from the interview, and each colour represents a different.
The signal's quite bad, I think.
These were around sort of shame. Oh, apologies. Shall I just see if I can change over to a different? It's a shame. It's saying full on my laptop.
It's the audio keeps freezing on my end a bit. Yeah. I've managed to. I'm changing the slides myself now, so that's all right.
I think might have lost my.
See if I can change the audio.
I think we might have lost you, Maya. Is it worth moving on to the next slide, Dan?
Yeah, we could do. Can you hear us, Maya? Or
I don't know, Dan, can you talk us through this slide?
Yeah, sure. I'll try. I'm not as familiar with this part, but so there were lots of perceived solutions actually that Maya discovered as part of the interviews, and some aligned quite well actually with what Tamsin was talking about earlier. So one in particular that stood out was the use of, I was just trying to find it on this slide, but there was the use of a lot of people suggested the sort of use of veterinary sort of vets, and that seemed to align with your study quite well, as a way to sort of to help with these sort of mental health support and sort of well-being mechanisms, I suppose. So that was something. Yeah, you can see that as the second point there on this slide that you should be able to see. There was some around sort of building drought and flood resilience as well, which also came across from the survey, such as a lot were quite high level, I suppose, and Mayor's currently sort of going through the sort of theming and coding from the interviews, so there'll be more sort of specific sort of details that come out from this as we go forward. I think that's, you can see most of the sort of initial outcomes from the interviews on this slide, really. But yeah, looking at the sort of food production as a core to national security, there were lots of sort of concerns around that. I don't know if you're back now, May. I can see you.
I mean, just thinking of the time, do you want to wrap up?
Yeah. There's just one more slide after this.
Okay,
anyway.
Yeah, of course I can. I'm so sorry about that. It's saying full network on my computer. I'm not sure why, but yeah, the main thing I think was relating to Tamsin earlier with the sort of tailored mental health support at feed reps and things like that. And I think one thing I just wanted to quickly mention was feeling like they have that sort of lack of intermediaries between sort of farmers and sort of policy and things like that was a huge theme, and feeling like we need sort of we do need more sort of drought and flood resilience moving forward, and making sure that post-climate event support is more clearly outlined. And just really quickly, just kind of outlining the next step. Have I frozen again? I'm so sorry. I was going to be condensed into a thesis article, and then the findings are going to be shared with the NFU and also with the HSA for next steps, and also insights shared with all our participants that are also interested. Thank you so much for your time, and also thanks to, same with our with the previous one, just people contributed to it as well.
Thank you so much. I mean, I think what we've seen is that it's not just about making farmers aware of support for their mental health problems. It's also looking at what can precipitate mental health problems, and it often lies out with the farm and the farmer, and it's at government and policy level. So really good. Thank you so much. Any questions before we move on to the next talk? So if anybody has got any questions, then please do put them in the chat. So I'm going to struggle with my phone that I'm using as a stop clock. So got that sorted. So now I'm going to ask Kim Bevan, Matt Rawsthorne and Josh Hall to talk about a novel digital mindfulness-based intervention to support the mental health of farming communities.
Thanks, Carolyn, and thanks, Tamsin, as well, for inviting us. We got some funding from SBRI, which is the Small Business Research Initiative, and that SBRI kind of try to accelerate innovative technologies in the NHS, but specifically into tackling unmet needs. And that was why we decided to focus on the agricultural community, because we knew there were a lot of unmet needs, as we've heard about from Tamsin and from Dan and Maya. There's three of us going to be presenting this, and we're going to be presenting on the kind of parts that we had most to do with in the study. So just to say what we're going to cover, we're first of all going to just briefly give you a project overview and research objectives, which will be me, because I was the principal investigator for the research. And then we're going to look at the role and impact of the lived experience advisory panel. As we've already heard, it's so important to get embedded in the community and make sure that you get advice from the community as well. So Matt is going to take you through that. And then we're going to finish off with the key challenges and what worked and the important lessons for future delivery. And we have so many of those. And Josh is going to take us through that part. So I'll start with looking at the project overview. We decided straight away that we needed to work with partners who were embedded in the agricultural community. We were looking to explore how feasible, acceptable, and if there was any impact of our virtual reality mindfulness-based intervention. Just so that you know, the intervention is based on mindfulness-based cognitive therapy, MBCT, which has shown to be very effective with depression and anxiety, but quite difficult to access because it's usually presented in groups at a specific time. And we knew that would not work for a lot of communities, actually, with the agricultural community being one of them. So we thought that having this delivered by virtual reality that farmers could use at home might just be a really good solution for them when they were finding difficulty to access. So, but working with the We Are Farming Minds of the DPJ Foundation was a really important part of it for us. They are both charities working with the agricultural community on mental health. We Are Farming Minds is based in Herefordshire and the DPJ Foundation is based in Wales, but they do a whole Wales approach. We also worked with Health Innovation East, who were doing an objective evaluation, and they were the ones who did the evaluation strategy for us, and the University of Cambridge, who gave us academic advice and also the ethics for the project. And then public involvement was embedded through our LEAP that you'll hear more about later when Matt takes you through that. So our objectives were many. We wanted really to have a look at barriers and enablers, feasibility, as I've already said, and we really wanted to understand engagement and retention because we knew that could be something of an issue. And we were aware with the discussions from charity partners and our lived experience panel that one of the key challenges for the agricultural sector is access to appropriate mental health interventions at a time and place that works for them. And you've already heard something about that, and that was very clear to us. We were also aware that recruitment might be a challenge for us. I don't think we realised quite the extent of that challenge as it happened, but we were aware that there would be one. But we'll go into that in a little bit more detail later. Just to briefly run you through the findings before we start to have a look at some of the challenges. Those who did complete, and in fact there were only 12 people in the end who completed. We were aiming for 50 to start with. We ended up with 12 people who took the whole program all the way through. There were extraordinary results. I mean, they were so good. And Health Innovation East are doing the statistical analysis on it. And the statistician got very excited. And I said, yeah, but we need 30 participants before we get anything that's really valid. But he was very excited because there were high significance in terms of their PHQ-9, which is a measure of depression symptoms, GAD-7, which is a measure of anxiety, and also the work and social adjustment scale that measures general functioning. So it is exciting. It has potential. Lots of qualitative data as well that's just going through analysis at the moment with Health Innovation East is very positive. We've got some amazing quotes from the people who completed it. But the key issue is the numbers. But just before I hand over to Matt, so we can start to have a look at what the lived experience panel told us and what we did with them. One of the things that we really did get out of this, which was amazing, was we found a community for ourselves as well as the agricultural community, and that was amazing. So we found academic partners, but also other partners who are embedded in the community, so that if we do find joint funding opportunities in the future, we've got a really good community to work with. I'm going to hand over to Matt now.
Thanks. So to ensure we built something that met the needs of the agricultural community, we asked our charity partners to put us in touch with farm workers willing to share their experience of dealing with mental health problems. And as the project progressed, we realised that we needed to broaden this group to other trusted professionals. And also we learned that in the context of the scarce resources, as you've heard, non-eligibility was perceived to have a potential negative impact, which was making people reluctant to signpost to the study. So we included some people who'd had that experience to help us improve our response to it. And this group was fundamental in shaping the research, but we had to be pragmatic about how we involved them. So if we can go to the next slide, thank you. So they helped us adapt the intervention to match the constraints and the specific issues faced by agricultural workers, and to make it more appealing and relevant, and so to fit with the realities of their daily lives. And crucially, they refined our recruitment strategy in terms of the content, the channels, and the key messages. And so they gave us great insight into the barriers faced by people trying to access quality mental health support. So I'll pass on to Josh.
Thanks, Matt. Can everybody hear me okay?
Yeah.
Yeah.
Okay, fantastic. So yeah, I'll talk you through some of the challenges. I know Shim and Matt have mentioned some of them already. So as we've established, the recruitment was more challenging than we initially anticipated. Obviously, there are sort of seasonal pressures, and I'm sure we're all aware, farmers, agricultural workers are very time poor. So having this time to participate in a study isn't something that everybody had. But I think there's also things like, mental health stigma, low awareness of mental health support options, but also low awareness of just general mental health support challenges, perhaps putting down or just having a bad day when actually they may be struggling with depression or anxiety. And I think that awareness was something that really came across. And I think what we found is that the importance of building that trust and credibility. I think having the farming charity partners was crucial. They did 90% of the recruitment. We did explore other avenues, but most of the recruitment came through their channels as trusted sort of charity partners. So that was really important. And then, things like the connectivity issues, we did do a health equity assessment before we started this. So we were sort of aware that there might be some inequities. But yeah, these are some of the key challenges. And then in terms of recruitment, so just wanted to show you the evolution of our flyer. So when we first started it, well, that looks really slow now. We perhaps started with perhaps too much information, perhaps using terminology in saying mental health that might have been slightly off-putting. So you'll see that as we worked away, we got lots of advice and feedback from our LEAP, and then we ended on things and changed the wording and the approach a little. And as long as some of the imagery you can see on the first flyers, that's me in the photo. We then got somebody, actually a farmer, to take a photo with the headset on, to perhaps be slightly more relatable, but changing things from saying join our mental health study to get your head back in the game, so trying to be a bit more motivational and less emphasis on the mental health and the sort of academic side of it. And then I'll just take you to the next slide. So what did help? So whilst we did sort of initiate our recruitment process with the two charity partners, we then ended up expanding our recruitment beyond the charities to other trusted networks. So similar to what Tamsin mentioned earlier, we started working with vets. They were very helpful. They're people that are with these people all day, every day. So they had some really good insight, and a vet actually joined our LEAP and provided some really helpful feedback for us. And then combining digital outreach with in-person, so the farming charities, they were going to, farmers markets and trade shows, and getting the headset in front of people to really build that awareness. We use clear follow-ups, so via text message, phone calls. That was both during the recruitment process, but also throughout the study to help sort of boost levels of engagement. And we had the majority of the people on the study did sign up for our reminders that went through sort of once or twice a week to help them stay on top of things. And then, really framing that messaging around stress and daily pressures rather than focusing specifically on mental health. But you can see so some of the other things that we've mentioned here, but just conscious of time, I will move on to the next slide. So what were the key learnings? So again, recruitment definitely requires more time and reach and persistence than we initially expected. Trust, language, and the messenger are critical for those engagement, and you need to make sure that any interventions really fit the farming culture, their rhythms, and the context. So that's why the LEAP are so important, and working with them going forward will be key in sort of finding a solution that is successful for the agricultural community. And then just summary and conclusion. So although we have fewer participants, those that did complete it, like Kim said, we had really positive results. So we're really sort of excited to see the final report from Health Innovation East and what that looks like. Again, we've made some really excellent connections with others, and we're really excited about what we might be able to do in the future based off this study. We've built some really sort of important connections with other organisations that are, really care about mental health within the agricultural community. So we're really confident that going forward we can do some more exciting work in this area and hopefully help more people. We've learned a lot that will, inform our future work. And yeah, we just look forward to hopefully making more of a difference in the community as we move forward. So thanks very much for your time.
Fantastic. Thank you. Thank you so much. That was really interesting. So I'm going to ask probably what's a really stupid question, but it's about the tech, and is internet connection required? And if you live in a rural area, is that a problem? So just a sort of basic stuff that probably everybody else understands, and I'm stupid. Yeah, but thank you.
Yeah. So no, not a stupid question at all. Kim, did you want to take this one?
Yeah, I can do. So yes, there is some need for connectivity at the beginning. So when they first log on and when they first get set up, they do, but it doesn't have to be live all the way through each of the sessions that they do. So there's 8 sessions, and they do 1 a week, and they wouldn't need connectivity all the way through those sessions, but there is a need at the beginning. So that could be something of a barrier. Absolutely. It was not a stupid question. It was a very valid question. Yeah.
Thank you for clarifying. That's really helpful. Claire.
We often hear that majority of the farmers are males, and a lot of the time they can't use technology and they're reliant on their wives and partners to actually do the technical side of things. So how did that actually work with this project?
So do you want me to take that as well, Josh? So we did phone calls with each of the farmers who'd taken their headsets home. So they had them at home, they were sent them, but they were talked through how to use it. So somebody from the project, either Josh or somebody from We Are Farming Minds or from DPJ Foundation, actually talked them through it and helped them to get the connectivity and help them to understand how to use everything. And they did it there and then while they were on the phone. So hopefully that really did help. And I don't think anybody had huge problems with the technology. That wasn't part of the reason why we struggled to recruit, I don't think. I think there were other reasons behind that. So
thank you, that's really helpful. Okay, so I'm going to move on to, thank you very much, everybody. I'm going to move on to the Rural Minds project. So we've got Jordan, Richard and Daniel. I don't know if you're all speaking, but anyway, off you go.
Hi, hello everyone. I was going to say good morning, but we're afternoon now. Can everyone hear me? Good, I see you nodding. That's a good start. So my name is Dan James. I'm a GP partner working near Bury St Edmunds, and speaking with me today is a colleague, Dr. Jordan Sigarides, who will introduce himself in a few moments. The co-founder of this project with us was Dr. Richard West, who can't be with us today and sends his apologies. So it's just the two of us, I'm afraid. But I'm going to be talking about the Rural Minds project. So this is an educational project initially for clinicians, but also with a farmer-facing side. And hopefully my slides will move on. Perfect. This is all working well. Talking about the idea of this being a hidden problem. So one of the statistics that Tamsin said earlier, from I think it was from the Rabbi Big Farming survey, that 91% of farmers think mental health is the biggest hidden problem in farming facing the community at the moment. That same survey suggested that about 36% of farmers are probably or possibly depressed, and nearly half of them report constant anxiety. We also know it has some of the highest suicide rates within the UK workforce. So it's difficult, as I'm sure other people who've spoken today, to put out precise numbers for this, but there could well be an increased suicide risk around twice compared to the background population. Some better data from a global health perspective from the USA suggests it could be as much as 3 or 4 times the background population risk. The picture here is a gentleman called Rob Alexander. So he's a farmer that we worked with in developing this resource, whose father, also a farmer, died by suicide. And Rob now speaks very openly and very powerfully about his experience, and his voice is part of the experience that we've built. So agriculture accounts for around 1 to 1.5% of the UK workforce. So we're not talking about a small population in the grand scheme of things. In rural areas like Suffolk, it's at least double that, and significantly higher when we're talking about other people connected with food production and farming related industries. So it's not a niche issue. This is a high risk, underserved population that we're talking about. We had conversations with farmers and with rural communities, and a number of consistent themes came through those. So access to seeking help isn't just about time, it's about geography, identity, and trust in the people they're seeking help from, and distance matters. Services can be harder to reach, both physically and psychologically. And we came across a lot of the same cultural factors that people have spoken about this afternoon. So recurring themes of stoicism, of self-reliance, not wanting to be a burden of others, and the idea that work and home are completely intertwined. You live where you work, you look out of the window, and all you can see are a load of jobs that you haven't done yet. So there's no real separation. And layered on top of that are some of the stresses that we've already heard about today. So increasing pressures, financial, regulatory, and environmental. The system more widely starting to recognise that rural and indeed coastal communities may need a slightly different approach. And indeed, we know that the Chief Medical Officer's 2026 report is going to focus on some of the difficulties of providing care to those populations. But we're still largely trying to fit rural problems into urban models. So the reason why we wanted to develop an educational resource about this was that we found that traditional medical education so far seems to fall short on this. So we're aware of the risks, we're aware of the stresses, and I'm aware of those because I work as a general practitioner serving a rural community. So in contrast to Tamsin's population, we're 90% arable farming in East Anglia. It's wheat, barley, and sugar beet, but a lot of my patients in the 100 square miles that my practice covers are farmers, families, and people who work within the industry. So I know this because I've met farmers and I've worked with farmers, and I've indeed experienced suicides among some of the patients that I've cared for. But I was never taught any of this at medical school. So I did my GP training at St Thomas's. I went to medical school at Barts, both fine institutions, but didn't mention anything about some of the pressures of rural life, and potentially why would they? We're looking at an urban population. And if the workforce is trained in urban environments, though the new generation of medical schools are bucking that trend a little bit, obviously, a lot of our learners will have very limited exposure to rural life. So we rely on assumptions. We picture the countryside life as peaceful, even privileged. There's a picture postcard view of it being a wonderful place to live or to retire to, and we don't instinctively recognise it as a high-risk environment. And you can't learn about rural general practice in a lecture theatre, because it isn't just knowledge, it's about understanding, and understanding comes from experience. So my experience was getting out there and working within it and learning about it. But our idea behind the Rural Mind project is a fairly simple one. What if we could bring that experience out to the clinician? So if we let the learners step into the farmer's world and hear real stories, and understand the context that people are living and working within. So the resource was co-produced with farming communities, not just telling their stories, but actually building the resource with them. And the educational value here, the goal is empathy and understanding, not just information, because what we found is that human stories drive deeper understanding and better retention. So we didn't want it to stay as a small local project. The aim was always to create something scalable, something that could take our local insights from working with our stakeholders and with our populations, and build it into a national educational resource. And what's been really powerful for us is that the people affected by the problem became part of the solution. Our stakeholders became our partners and indeed our funders. So we were supported by the Felix Thornley Cobbold Agricultural Trust, who funded building this resource. And this is an agricultural charitable trust. Usually they're doing scholarships for agricultural college and funding seed trials. So this is the first mental health related thing they'd ever been asked to help with. And we were hoping for a little bit of funding from them, and we were going to ask for other people, and they surprised us by funding the whole thing. So we thought we'd better get on and make it. We also work closely with Cambridge-based Revolve Labs, who actually have built the resource with us, and have had backing from the Royal College of GPs Rural Forum, and lots of others. So that's the problem, and that's the idea. And what I shall do is hand over to Jordan, who's going to show you how we turned that into something that people can actually experience.
Caroline, did you want to quickly say something?
5-minute warning, yeah.
Oh, perfect. Okay, great. So, hi everyone. I'm Jordan. I'm a doctor as well. I'm a rheumatologist based in Cambridge, and I'm also the Chief Medical Officer for the Cambridge-based Revolve Labs that Dan just mentioned. So I've produced virtual reality interventions for healthcare education for about 7 or 8 years now, and me and Dan have worked together for some time. So I'm going to talk a bit about the development of this intervention. So when we first started out, as Dan clearly said, we worked very closely with the Felix Cobbold Trust and with farmers themselves. And we realised actually that although this was intended initially to be a resource for healthcare professionals, there was a good opportunity here to produce a resource for 2 different reasons. One for healthcare professional education, but also one for farmers themselves and people that know farmers and people that work with farmers to support awareness and insight into the challenges that we've all described in this session so far. But you might ask, well, why VR? And we did hear a little bit about VR earlier, but in this context, there's good evidence now that virtual reality can produce superior learning outcomes in education compared to traditional methods. But really, as Dan quite clearly said, an experience is what's needed here. We need to put healthcare professionals into the shoes of farmers living in these difficult times. And VR is a fantastic and unrivaled way of doing that. When you put a VR headset on, you don't see anything outside of that virtual world that you're immersed within. And when you're in the perspective of someone living with mental health challenges in the farming community, it feels like you're standing in their shoes and having the conversations that person is having. So VR allows us to reduce the distractibility of life, provide deeper emotional connections, and provide an interactive, accessible resource that can be sent out to farmers, as was done in the previous project, but also provided things like agricultural shows, educational events, and other implementation modalities. So a little bit about the storyboarding of Robert's journey here. So we always start these projects with an initial storyboard which outlines what the project's going to look like, and this was developed in line with healthcare professionals, academics from the University of East Anglia, and also people from local charities, people from the Yellow Wellies, but also from Yana and local farmers. And the stakeholder input in this was absolutely essential. We wanted this to be as valid as possible, something that reflected real stories and real journeys. And that stakeholder input was throughout the development of this process. We then came out with a script, which was actually written by Dan himself, who has some experience doing this now, which we then got actors to deliver. And we wanted this to be to provide an emotional tone, but also a tone that's relevant and valid. So we used professional actors to deliver that. So how did we create the content? Well, we captured the content with a 360-degree camera. So this camera is essentially like a normal camera, but instead of capturing one perspective, it captures absolutely everything. Captures in 8K quality. So when you put that into a virtual reality headset, if you look to your left, you see what's on the left of the camera. If you look to your right, you see what's on the right, and it's in high quality crisp. So it feels real. We filmed in multiple locations. These were some of our friends for the day that we filmed with. And it was in a farm in Suffolk that was in the majority of the filming, but also in GP practices around Suffolk as well. And like I say, we filmed with actors across these multiple different locations. We also had lots of crew members. So we had sound technicians. We had myself doing the filming and the directing. We had, I think, six actors in this experience itself, and obviously all of the stakeholders. And we were having fish and chips for lunch at the farm, kindly provided by our farmer stakeholder. We then formed packages. So these packages were interactive, so they allowed for you to have moments of reflection in between content. So you saw a piece of the scenario, and then you had stop and think moments, which allowed you to reflect on what you'd seen and provided different sort of questions and prompts for you to think about. And we created this into an interactive package, so it had components to it that you could click and learn more about certain challenges that you'd seen, particularly for the healthcare audience. So hopefully, if this works now, I'm going to show a quick trailer of the overall experience so you can see what we're talking about here.
I understand, but I'm telling you, if I don't get some slack, just a few months, then I'll drown.
You can't keep carrying this on your own. It's too much for one man.
It's my job to carry it. If a man can't hold on to his land, he ain't much of a man.
Robert, have you been having thoughts about ending your life?
Yeah.
Okay, Robert. Thank you for being so open and honest with us about how you're feeling. That takes a lot of courage, and it's an important step to feeling better.
It's the first time I felt even slightly positive about anything in weeks.
Well, that's worth holding on to.
You've made a lot of progress, Robert. It might not feel like it every day, but I can see it. Think about how far you've come compared to when you were seeing the crisis team.
If ever things start to feel difficult again, you know where we are.
I do. Thanks, Doctor.
So what you can see in that trailer is you follow the journey of Robert, who's a farmer who's struggling with his mental health, from a point of desperation through to showing you things like mental health first aid with a farm worker that he works with when you step into his shoes, through to him gaining support through the crisis team, through a counsellor and through his GP, to finally coming out at the end of it feeling back to himself again. So it shows you that journey from desperation to recovery. Since we created this, we've launched it locally at Bury St Edmunds in Suffolk, where we invited all of the actors, but also, of course, the farmers that were involved in this and local leaders in the agricultural community. But we also launched this at the House of Lords in November, and we were able to speak to parliamentarians, but also members of the House of Lords about this really important topic. So this kind of shows that we can utilise this sort of technology as a way of having these centralised debates that will hopefully in the future help us to frame policy and improve farmers' lives. But the real question now is, how do we get this into the hands of all farmers and GPs across the UK? And there's a couple of dissemination tactics that we're looking to approach. So in healthcare, we're trying to roll this out across multiple ICBs. So this is now available in Suffolk and North East Essex in VR, but also in South London and East London. And we're slowly trying to roll this out to other ICBs as well. We presented this at the DMEC conference in Birmingham in November or December. And we're looking to try and, as I said before, get this adopted at a national level for healthcare professionals. And our farmer-facing version, we're trying to target young farmers through the Yellow Wellies community, but also agricultural colleges. We're trying to gain collaboration with Yana, who we currently do have collaboration with. So hopefully this will be on their website very soon, but also DEFRA and the NFU. And there'll be direct outreach at agricultural shows across the UK. And this is a bit of a call to action just to finish. If you can help get this project to the people that need it, please reach out. There's no cost associated with it. If you feel that this could be something that could be implemented in your region or could be hosted in a certain way, please do let us know. And you should be able to get my details from the team that set this up afterwards, so we can have a chat in the future. Of course, we want to say a massive thank you to everyone that helps us with this project, and obviously thank you for listening. If you'd like to have a look at this, you can scan the QR code on the screen or go to the Revolve Labs website, revolvelabs.co.uk/rural minds, and you'll be able to see both versions for yourself. Thank you so much.
Fantastic, thank you. So it's 1 o'clock. We don't have time for questions, I don't think, but just to say thank you to Dan and Jordan, brilliant presentation, really good innovation. So just to confirm that this recording will be on the NHR3 schools. Obviously there's a QR code for the Rural Minds project. We can put all our contact details on the website, and we've also got the illustrations from Nifty Fox, which I think hopefully again we can put on the website. So I really hope that people have enjoyed today's webinar. I hope we've all got some key takeaways and some key messages, and hopefully we've also built up sort of a network through doing this work, and we can work together in the future. So, and thank you to the NHR3 Schools Mental Health Programme for facilitating this, and also for funding Tamsin and mine work. Thank you very much, Claire.
Thank you, everyone.